Hi everyone, this is Dr. Mehmet Erdoğan by Smile Hair Clinic. I'm one of the hair transplantation surgeons and I would like to share you with one of my patients' case study with the photos and the progress. So let's get into it. So our patient is from Australia, he's 24 years old. He's using finasteride for 1.5 years. I think whatever he sent us the photos and when we have the evaluation in the clinic, we see that he has a diffuse thinning just from front till just the crown area. I will show you by the photos in detail. He doesn't combine finasteride with minoxidil, which we usually want to combine it with minoxidil as to get the better result together, because finasteride is morely for hair thinning, miniaturization, but minoxidil is more fit the circulation of the area. Sometimes we don't know the reason behind these hair loss problems. 90% we know that it's mostly with the androgenetic alopecia and male pattern baldness, which doesn't fit with this patient too much. That's the reason maybe it's better to evaluate the blood test, better to evaluate the DHT levels, testosterone levels. Yes, it's a good thing to start finasteride because there's a thinning miniaturization, but I think it's more important to use with minoxidil to get some blood flow to that area too. Okay, let's check his photos. As you see, it is very visible from front till back with the skin. I mean, you can, even with there is not too much light on it. There is not too, I mean, it's not wet, but still you are understanding that you are still noticing that he has some lower appearance in the crown, in the mid scalp, and in the frontal part. So the front is also like that, and when you shave, I think it is more visible that he has so many areas to be transplanted. With this kind of patients, we wanted to mainly focus on one area, of course, but it is very surprises. It's full of surprises, because when there is some more hair, it's covering the other areas, but when we shave, we are seeing more gaps to be filled in. And for this patient, from front till crown area, we need to increase the overall density. That's the reason we try to get as much as we can from the donor area, and it was 4,350 grafts, which is very normal because his donor area is also affected by the crown area's extended hair loss problem. You know, you have frontal part in the recipient area, mid scalp, and the crown. Crown is as a circular area, but that circle extends and also merge with the donor area in sometimes, which is making the donor area size little smaller in size and narrow in size, so you can't able to get too many grafts from that area. But yeah, we have the good numbers, so we planned, as the patient also requested, from front till the back. So let's check the first month photo. From the top I'm looking. In this period we expect some hairs to be shedded because of the shock loss problems, because of the circulation mostly, but he's good still condition, and he still have some much better hair than before, so it looks good. So let's jump into the third month, and now that is the month that we see the progress is starting just. Okay, so it's not a must, by the way. It's not like a calendar date. It's just starts on the third, sometimes fourth. But after that, sometimes it goes very quickly and sometimes it gets very slowly. So usually we want to see the result at this 1 year, but sometimes we see very early results like 5 months or 6 months. It depends on also the finasteride, because the patient is on finasteride. I think it's also very effective to use it too. So I think it's very good from the top view with the frontal part, the mid scalp. Crown seems good, but it could be a little bit back, so we can't see it. Side, it looks very good. Donor area seems very good. From this perspective, I think crown area seems good too. So far, even the third month, I think patient is happy already. So let's check the 6-month photo right now. He is a longer grafts, longer hairs. His crown area is much better now. His mid scalp is also good. The frontal part is good too. He is using somehow some curly and mixed hair. He doesn't probably style right now, but looks good so far. And let's see this 9-month photo right now. Okay, it's a little bit more longer, of course, but it's covered more areas. It's, I think he already became like a very curly and very long hair, and he would like to just mix it, so it looks very good. The front is good too, sides looking good, and the donor area is good too. So I think patient is very satisfied with the result so far. We are also satisfied with his condition, because in this kind of patients, if there is a thinning process, if there is some problems in the thinning areas, also the transplanted hairs may have the same thing, same destiny with the existing ones. So if it is finasteride oriented, that will help. These kind of patients, of course, once they come to the clinic, they start minoxidil or the other supportive things to their treatment. That gives much more effort, for example. But in the future, I mean, everyone should keep something. Even you have the hair transplantation, even you are using the medication, you are a candidate for hair loss. So if any time it happens in your lifetime, I think you should still add finasteride and minoxidil to your schedule, at least some periodical parts. Yes, you shouldn't use for a lifetime, but probably as periodically you can use, stop, and if it happens, you will start again. So thank you for watching us. If you still have some questions, please write on the comments below. Thank you.